So maybe we can wait half a minute or so for people to leave the room who wish to do so, and for those of you who want to raise some questions, please feel free to do so. Please step forward to the mics, and we have time left to address questions if there are any. Half a minute break, or just a second. Seat. So, we can start with the questions. One question over here.
Thank you for three very interesting presentations, and I would like to address a question to Christian Hoffman. I was wondering whether the increase in leptin and resting energy expenditure was primarily associated with the actual BMI, or if it was also associated with the rate of weight gain.
It was, of course, related to the BMI, of course. So, but I tested for the influence of the other factors, the delta BMI. So, of course, at discharge there was a correlation between BMI and resting energy expenditure, as expected.
What I'm actually asking is whether the adverse effect of the increase in leptin could be partly avoided by slower weight gain.
Well, we don't know that, but I would like to prove that. That should be proven, but because it could all be an epiphenomenon, but at least it has shown that it could be a marker. I don't know if it's directly connected, but it seems to be a marker. And you should prove, of course, that is really relevant, or in a direct way.
Yes, please.
I just want to ask you about the use of, as you know, that risperidone is being used in some quarters to try and modify the intensity of the anorectic symptoms and perhaps reduce the amount of anxiety. Now, of course, risperidone gives, one of the side effects is weight gain and increased appetite. I'd be interested to know whether you have any knowledge of whether that affects leptin or the other neuropeptides that you mentioned.
Maybe I can address that, because we had back in I think it was 98 or 99, we had the very first study on leptin levels in atypical neuroleptics. So what we did, we looked at patients who were switched to clozapine and then looked at leptin levels. And actually what happens is you can see a roughly about a 100% increase in leptin levels during the first week of treatment. And this finding has subsequently been, there's still research going on in the same field, been replicated for olanzapine, has also, I think, been replicated for risperidone. So all of these substances lead to an increase in leptin levels, but not only leptin levels, but other cytokines. And it is currently not known whether this is an effect of short-term overeating induced via these atypical neuroleptics, or if it is an independent mechanism. So there's a lot of debate going on currently on how to explain these increments in leptin levels based on treating patients with, mostly of course schizophrenic patients, not patients with eating disorders. In patients with eating disorders, we do not have, to my knowledge, systematic data on what happens to leptin levels during treatment with, for instance, risperidone or olanzapine.
But it's a very interesting question, because the effects that you have from olanzapine or risperidone on appetite and weight gain are not well, they are far away, in anorectic patients are far away from that we've seen in psychotics or patient. So the weight gain is very few compared to patients who get olanzapine or risperidone when they have psychotic disorder. Well, we use olanzapine quite a lot in chronically anorectic patients. So my clinical experience is that as long as these patients don't have a weight close to target weight, this is the effect on weight gain or appetite is not very huge. It is there, I think. But we have some patients who are on olanzapine after they've reached the target weight, and sometimes these patients then they shoot up with the weight. I cannot tell that it's got something to do with olanzapine, but I think it's the effects are not the same in starvation, and I would like to see the data on leptin, perhaps on other neuropeptides, but we don't have it.
Yeah, I was wondering if there was any data on what happens to the leptin that's gone up if you maintain a normal body weight for some time. Does it then normalise? I'm asking because I've seen a number of patients who, probably about 4 months after they've been normal, they have a fairly sudden and otherwise unexplained drop in their drive to exercise and their levels of anxiety and an improvement in their mood. I was just wondering if that could be related.
We would assume that there are relationships to psychopathological dimensions in these patients due to the upregulation in leptin levels, and actually there are findings in the OB mouse that has no leptin, indicating that this mouse might be in a state of depression or might have a sort of depression. And actually what we typically see in patients with anorexia nervosa, we see sometimes basically almost overnight change in their mood, going from depressed mood to a normal, I would say, or at least to an elevated state of mood over a very short period of time. This typically occurs, I would say, after about 6 to 10 weeks of treatment, where we see this sort of switch, which we cannot attribute to systematically, at least, to any other therapeutic effects. This is one psychopathological dimension. I would definitely think that the intensive motor restlessness of these patients is lowered by increasing leptin levels. This might be a very direct link. And it is indeed also conceivable, to my opinion, that anxiety levels are also modulated by the increments in leptin levels. However, these are all very remote. Mood, anxiety are far away from the leptin receptor, so it's a lot of secondary regulatory systems probably accounting for the fact that it takes a lot of time, and you might need additional metabolic improvements to actually then have, or neurobiological alterations to then have these effects become prevalent. For instance, for the restoration of menses in patients with anorexia nervosa, it's not, the leptin level is the first critical key, but afterwards, of course, other systems also have to normalize before menstruation can resume. So it's, of course, complex systems.
But is there any data on when the leptin actually normalizes, or if it does?
Well, of course, it normalizes after, if the weight is stable, it will normalize. Johannes showed that after some time on this high level, it will normalize. But the problem is what you do with the patient at that time.
So, there are no other questions. We thank you very much for attending this symposium. Have a nice meeting.